What if I told you that some of the very pills seniors rely on every single day could secretly turn into a dangerous mix when taken together, and that doctors are quietly warning older adults to be extremely cautious after the age of 65? It sounds almost unbelievable, because each of these medicines on its own is considered safe and helpful. But the truth is that when certain drugs are combined inside the body of someone with slower metabolism, weaker kidneys, or an aging liver, the results can be devastating. Doctors in the United States have identified 6 specific medication pairings that can cause life-threatening complications for older adults. And sadly, most people don't find out until they land in the emergency room. One of the biggest red flags is when blood pressure medications like ACE inhibitors are paired with diuretics, the water pills often prescribed to reduce swelling or fluid buildup. In younger patients, this mix can sometimes be managed, but in seniors, it can push sodium and potassium levels to dangerous lows, causing muscle weakness, irregular heartbeats, and confusion that can be mistaken for dementia. Another hidden danger comes from combining blood thinners, such as warfarin, or newer options like apixaban, with common painkillers like ibuprofen or naproxen. Each medicine has a purpose, but when used together, they silently increase the risk of internal bleeding, the kind that doesn't show symptoms until it's too late. Then there's the mix of sleep aids and allergy medications, which both have sedative effects. When taken together, they can slow down reflexes, cloud memory, and make seniors 3 times more likely to suffer a dangerous fall. Families sometimes panic, thinking their loved one's memory is failing, when in reality, the culprit is simply the way those 2 medicines amplify each other. Another risky pairing involves antidepressants, especially SSRIs, mixed with migraine medications. This combination can overload the brain with serotonin, creating a condition called serotonin syndrome, which shows up as agitation, rapid heart rate, sweating, and even severe confusion, a frightening situation that few families expect. Statins, which are used to lower cholesterol, also carry hidden dangers when combined with certain antibiotics or antifungal drugs. Seniors may suddenly experience muscle pain, weakness, or even liver damage without realizing the connection because the symptoms sneak up gradually. The last major risk involves diabetes medicines, especially insulin or sulfonylureas, when combined with heart medications like beta blockers. Together, they can cause blood sugar to crash so quickly and so silently that a senior might faint without warning. What makes all of this even scarier is that the problem doesn't come from reckless choices, but from a system where different doctors prescribe different pills without always talking to each other. A cardiologist may prescribe one medication, a primary care doctor another, and a specialist yet another, while the patient assumes that because these prescriptions are all doctor-approved, they must be safe. But in reality, no one may be looking at the big picture, and that leaves seniors vulnerable. This is why experts now strongly encourage older adults and their families to keep an updated list of every single medication, including over-the-counter drugs and herbal supplements, and to bring that list to every medical appointment. Pharmacists can be a powerful ally here, because they are trained to spot interactions that even busy doctors might miss. Something as simple as checking your medications once or twice a year could prevent a hospital visit or even save a life. It's important to remember that not all risks show up immediately. Some side effects build slowly over time. A little more fatigue here, some memory fog there, a few dizzy spells that get brushed off as just getting older. But in many cases, these are not signs of normal aging. They are red flags that the body is struggling with drug combinations it can no longer handle. The good news is that awareness gives you power. By asking the right questions, reviewing medications regularly, and refusing to mix new prescriptions without guidance, seniors can dramatically reduce their risks. After all, nobody wants to spend their golden years shuffling in and out of hospitals, when simple precautions could keep them safe, steady, and independent. So the next time you're about to reach for that pill box, pause and ask yourself, have these medicines been reviewed for interactions, or could they be quietly working against each other in ways you don't yet feel? Because after 65, protecting your health isn't just about taking the right pills, it's about making sure they're not silently turning into the wrong combination.